Right-sided stomach pain is more common because there are more organs on the right side that can cause pain, such as liver, gallbladder, and appendix. We will discuss the top 9 causes of right-sided stomach pain. The first most common cause is gastric distress, which means gas, bloating, and indigestion, usually causing mild discomfort on right side. This is typically temporary and will resolve its own. It is often caused by eating large meals quickly or consuming foods rich in dietary fiber. This fiber is not completely absorbed in the body, and gut bacteria digest it, producing gas during this process. Additionally, eating oily foods can slow down digestion process, causing discomfort. The solution is to gradually introduce fibrous foods to your diet and eat small portions more slowly, which commonly resolves gastric distress. And second most common cause is muscle strain, which usually occurs due to physical activity such as during exercise or due to improper movement. The pain usually increases with movement or touch and is relieved with rest. This gastric distress and muscle strain are responsible for almost 80% of all right-sided stomach pain. And 3. Gallstones are the third most common cause. Pain occurs when gallstones block the bile duct. Classical scenario is middle-aged woman experiencing severe pain after fatty meal. The pain can spread to the back and shoulders. The treatment involves ursodeoxycholic acid, which can dissolve cholesterol-based gallstones, which constitutes around 80% of gallstones. Surgery is considered the best treatment. Gallstones account for almost 10% of right-sided stomach pain. And 4. Kidney stones are more common in men, usually after age 30. High intake of protein, salt, and sugar, along with obesity and insufficient water intake, increase the risk of kidney stones. The pain is usually very severe and located on the right side or back below the ribs in case of right kidney stones, radiating to the lower abdomen and groin. The pain is sharp and intense. Urination can be painful and the urine may appear red or pink. Nausea and vomiting are also common. The sudden onset of severe pain and changes in urine color are strong indicators of kidney stones, a condition known as renal colic. The pain typically comes in waves and fluctuates in intensity as the stone moves, but it is generally very severe. Treatment can begin with pain medications followed by surgery or shockwave lithotripsy, which uses shock waves to break up stones into small pieces that can be passed in the urine. 5. Appendicitis is another cause and is a medical emergency in many cases. It is the inflammation of appendix, a finger-like tube connected to the large intestine. The classical presentation of appendicitis is a young person with pain that starts gradually around the navel and becomes more pronounced on the right side. This can be accompanied by nausea, vomiting, and fever. Almost 80% of appendicitis cases require surgical intervention. If left untreated, appendicitis can be life-threatening. A very useful diagnostic method is Roswing sign. It means person experiences right-sided stomach pain when you press on left side. Other important diagnostic methods include ultrasound and CT scan. And 6. Food intolerance. This condition means the body is unable to effectively digest certain foods. It is different from allergy. For example, lactose intolerance causes bloating and abdominal pain after consuming dairy products, and fructose intolerance results in pain and bloating after eating fruits. And 7. Ovulation pain. This occurs around the midpoint of menstrual cycle, approximately 40 days before menstruation. It can be right-sided, left-sided, or both sides, depending on which ovaries release the egg. The pain can be severe or dull and may last for several minutes or several days. About 20% of women experience this pain, which usually resolves without treatment. And 8. Liver inflammation. This can cause right abdominal pain if liver is enlarged. Hepatitis A, hepatitis B and C can cause liver pain. The pain is usually dull and aching, continuous and persistent. It may worsen during movement or deep breathing, and pain may exacerbate it when lying on the right side. Liver pain is not an early sign of liver disease, and usually other symptoms such as jaundice or skin itching are also present. And 9. Ovarian cyst. For women, an ovarian cyst can cause right-sided abdominal pain if it ruptures. This pain is sudden and severe. If the pain is severe and accompanied by fever, indicating a risk of internal bleeding or infection, that's why surgery may be needed. However, most cysts will never rupture and never cause symptoms. From above-mentioned causes, first 3 account more than 90% of right-sided abdominal pain. Other causes are very rare.